to parties in conference, including you.
Welcome to this webinar on using the Assist screening tool. Hello, welcome to this webinar brought to you by Y Health. This is a webinar about how to use the Assist screening tool for SBIRT and conduct a brief intervention for services. SBIRT Wyoming is an initiative of the Wyoming Department of Health through the Medicaid Division. Outreach and support for SBIRT is provided by Y Health as part of their Total Health Management Program for Wyoming Medicaid. That will be needed for completing SBIRT screenings and doing a brief intervention can be found on the Y Health website at www.wyhealth.net/SBIRT. The tools needed for SBIRT, the Assist screening tool, the response card for patients, the all use information card, back report card, and all health risks cards for the substances that are asked on the Assist screening tool. SBIRT is an acronym that stands for Screening, Brief Intervention, and Referral to Treatment. This is the screen which we will be discussing on this webinar, which is the Assist screen tool. This is a quick and simple assessment that identifies patients who may be at risk for substance dependence. The intervention, which is the BI in SBIRT, is a part that has been missing in medicine for a long time. This is a short motivational interview that helps to increase awareness into risky use of substances, but even more than that, it helps to motivate patients towards positive behavioral change. So it gives clinicians a way to be able to not only give advice and education, but help motivate patients to be really advice in the education that we're going to give them. The RT in SBIRT stands for Referral to Treatment, and an SBIRT screen can identify individuals who are in a high-risk category, and then the brief intervention would be used to send them to more extensive treatment than can be done in a doctor's office in just a few minutes. The screening tool is the tool that is used in Wyoming for SBIRT services. The Assist screening tool was created by the World Health Organization. This is their acronym that stands for Alcohol, Screening, and Substance Involvement Screening Test. The screening tool should be used and administered by a trained clinician. This was not intended to be a self-report, which means that this screening tool should not be given to the client to fill out. The beauty of SBIRT is that the intervention is completed a one-on-one with the practitioner or with the nurse. This is easily administered in 4 to 5 minutes, and for those who would screen at low or no use, this could be administered in less than 4 minutes if necessary. This is not just for those with suspected use. Useful screening is highly recommended because we would like to detect even low use in patients, especially in patients who are pregnant. Modal interview style of screening helps to develop trust with the clients, and the way the Assist questions are asked, it helps to develop a trusted conversation with the patient. The SBIRT screen also heightens awareness of health risks associated with using tobacco, alcohol, and other drugs. Clinicians are used to giving health risks for substance use. However, the way the questions are asked on the Assist screening tool and the way the brief intervention is conducted, the health risks now can sound different and have more of the internal knowledge of what they themselves can do to either cut back or stop substance use. That are covered on the Assist screening tool in tobacco, alcohol, cannabis, amphetamines stimulants, hallucinogens, inhalants, and prescription use or other drugs. So this is overuse of prescriptions, especially when we're talking about the categories of amphetamine or sedatives or opiates, which would include narcotic use. Of the ASSIST screening tool is that it gives both providers and patients a measurable device so that they can quantitate the health risks that are involved with substance use. This is important because now when the ASSIST questions are asked and a score is given, this is a measurable device, and this score can indicate to the patient whether they are over and above the usual limits for substance use. It's no longer the provider pointing a finger. The number is actually giving that indicator to the patient. This will help providers to be able to capitalize on a teachable moment. It also creates a window of opportunity for positive change, especially with pregnant women. Pregnant women have a literal internal motivator that also helps them to affect lifestyle change during this time in their life. This screening tool is the use of a culturally, socially, and economically neutral tool that has been used worldwide for well over a decade to screen for problem substance use. When these questions are asked, then scores the patient's answers. This score, which we've already talked about, is what helps clinician and the patient both determine substance use risk, because it gives a low, a moderate, or a high score for each substance that's screened for. Since that score above anything but low are then provided with a brief intervention to help them see an internal need, an internal desire, maybe to cut back or stop on that substance. This opens the door to start a safe discussion with the patient, especially when motivational interviewing skills are also involved in the conversation. So when starting the ASSIST screen, this is then administered one-on-one in an exam room as part of a patient intake. However, we all know that one-on-one encounters sometimes don't take place. It's best that can happen, but if another person is in the room, the ASSIST screening tool can still be administered. We're sure to explain confidentiality to the patients, and this screen is a part of all patient intake, that they're being singled out for this screen. Also, that the answers that are given are really just between the clinician and the patient. Of course, there are times of mandatory reports, but those times are very few, far between, in relation to the rest of the population who can highly benefit from having the ASSIST screen completed. Or start the ASSIST screening tool. If you simply say something like, I'd like to ask you a few questions now, this will just take a couple of minutes to ask these questions that you're already used to being asked about tobacco, alcohol, and substance use. Are you okay with me asking you these questions? And simply asking the patient if they're okay with being asked the questions is a respectful way to start the conversation. And personally, I have never had anybody say no to this question. They're used to being asked these questions on patient intake anyway. So starting the ASSIST screen, hand the patient the ASSIST response card. Like I said, all of the tools in the handout that I'm talking about in this webinar can be printed from the Y Health website, including the ASSIST response card. And to go forward in my slides here, the ASSIST response card looks like this. You have a training completed. This was a laminated card that I handed out, but also these cards can simply be printed out from the website and used that way. All the substances that I asked during the ASSIST screen are listed here, and as you're going down this list, the patient can be reading along with you. It has any questions about what these substances are, then ask you at the time. Also, scoring for the assist is right here for questions 2 through 5, and then on questions 6 through 8, they are scored a little bit differently, but these are here for your benefit as well as for the patient to see how their answers are being scored. Assist response card to patients, and these are the substances that I will be asking you about. If any question about anything that we're talking about, please ask me. Now, this will be substances that that you are using, including prescription medications, especially if you're using above normal limits, or especially in the case of pregnancy, if they're using prescription medications at all. And then you will go right into the assist screening questions with question number 1. In question number 1, in your whole life, have you ever used any of these substances? Have you ever used tobacco? And if they say yes, you would circle yes. Have you ever used alcoholic beverages? And they say yes, circle that. You ask all of the substances individually, and you circle their answers either yes or no. With screening tool, there is a roadmap right underneath all of the questions that tells you what to do next. If all the answers in question number 1 are no, you are done with the assist screening tool, and you can make $24 for that. If you have any questions about billing, there's also a billing webinar that you can go to. If there is yes to any of these items that we listed here, you will continue to ask question number 2 for those substances. Continue with tobacco and alcohol, and let's say that someone used marijuana a couple of times when they were in high school. According to answers here. The second question then, in the past 3 months, how often have you used tobacco? And never, not in the last 3 months. I have not used tobacco at all. I quit 2 years ago. You would circle a 0 here. How often have you used in the last 3 months alcoholic beverages? Say something like, well, I go out every once in a while with my buddies, or every once in a while I have a glass of wine when I come home from work. It's important to quantitate a patient's use of alcohol and the not only the use, but the amount that they're drinking during those times. So the alcohol use information card comes in very, very handy. We're talking to patients about alcohol use. Question was on the last question number 2. In the 3 months, how often have you used alcohol beverages? Let's say it's a 40-year-old woman, and she said, I have a couple of glasses of wine every once in a while when I get home from work. For the alcohol use information card, is say, according to these drinking limits, how many glasses of wine do you think you may have on those occasions? Or somebody who says, I go out with my buddies every once in a while. On those occasions, how many, according to these drinking limits, how many drinks do you think you're having? A 12-ounce beer at 5% alcohol is considered 1 drink. 18 ounces of a flavored malt beverage, which we like a wine cooler, at 7% is considered 1 drink. A 5-ounce glass of table wine is 1 drink, and 1.5 ounces of 80 proof liquor is considered 1 drink, according to the CDC. Now, to these drinking limits, a woman may decide that she's actually having more than 1 drink, because if she is pouring an 8-ounce glass of wine, it is more than 1 drink on those occasions. This with them, the maximum daily limits and the maximum weekly limits for drinking. For women, the maximum daily limit is 3, and the maximum weekly limit is 7 drinks per week. Again, these are according to the CDC and also SAMHSA, is that these limits should not be exceeded according to health risk limits for alcohol. For men, the maximum daily limit is 4, maximum weekly limit is 14 drinks according to these limits. And for men over age 65, it's actually for a maximum daily limit, and 7 for a maximum weekly limit, and of course, less is better. Over these daily drinking limits, 3 women and 4 persons is considered binge drinking. Question number 2, you want to quantitate how often they're drinking, and of course, the limits that they're drinking at according to those the drinking chart that we just talked about. Now, let's say you're still asking the questions in the past 3 months, how often have you used marijuana? Haven't used it at all, that would be a 0. And you would not ask the questions then for tobacco because they're not smoking anymore, or for marijuana until you get to question number 6. Let's continue with alcohol only for questions number 3 through 5. Number 3, during the past 3 months, how often have you had a strong desire or an urge to use alcoholic beverages? This is a question that starts to indicate dependence on alcoholic beverages. If someone is in an urge, even if they're not acting on that urge, it could be an indicator that they are starting to gain either an emotional or a physical dependence on that substance. Let other people talk about what an urge means. If they were a former tobacco user, they understand what an urge means. 3 months, question number 4 now. During the past 3 months, how often has your use of alcohol led to any health, social, legal, or financial problems? On question number 4, I also add relational to this question. That is what the word social means. It's relational. But when you add relational into this question, it makes it sound a lot different because we're talking about people who have actually noticed substance use issues in their life and have talked to them about it. So number 5, in the past 3 months, how have you failed to do what's normally expected of you because of your use of alcohol? There'd be having a hangover, not going to work, spending too much money drinking so they couldn't pay the rent. Whatever those is, you continue to say, never means not at all in the last 3 months. They haven't done that. Once or twice means that this has happened once or twice in the last 3 months. Monthly is 1 to 3 times a month. Weekly is up to 4 times a week, and day is anything times or more a week. You will see on this question that tobacco products are blacked out here. This is a World Health Organization tool, and so we're able to change this in any way from our perspective. But when I'm doing the screening, I continue to ask these questions for tobacco products because we all know that people do fail to do what's normally expected of them because of tobacco use. They bronchitis and they haven't been work, or they're taking book breaks, something like that. So continue to ask those questions for tobacco. Question number 6, we asked, these questions 6 and 7 are all substance issues. So you are going to go back to everything that they said yes to in question number 1. Questions 6 and 7 are considered as relapse prevention questions. So question number 6, has a friend or relative ever expressed concern about your use of tobacco because they said yes to tobacco in question number 1? Even if it was 2 or 3 years ago and someone expressed concern about their use, they would get a through this answer, yes, but not in the past 3 months. If you're a current user and someone has talked to them about any of their substance use in 3 months, they get a 6 for that answer. If no one has said anything to them, it is scored as a 0. And 7, have you ever tried and failed to control, down, or stop using? And we would be talking about those 3 substances: tobacco, alcoholic beverages, and marijuana on these questions. We filled out the assist screening tool with question number 8. Have you ever used any drugs by injection? No, never. This would be very current use in the past 3 months, and this would be yes, but not in the past month. This is the feedback report card for patients. So we're going to be going through scoring the assist screen tool. I will go to the next screen and then come back again. So scoring the assist, you add the total for each substance that the patient has used in questions 2 through 7 only. Do not include question 1. Do not include question 8. Do include question number 5 for tobacco, as we have discussed. If you have all of those scores added up, tobacco gets its own score, alcohol gets its own score, and cannabis gets its own score as well. You write those scores on the feedback report card for patients and then circle the category that they fall into. As you can see, the moderate categories for these substances are very generous. A lot of people do fall into a moderate category. It might be a low moderate category. But in those instances, a brief intervention is warranted, even for low use, to prevent a continuance or a escalation of the use of those products. So this feedback report card, write the substances on here, write the scores on here, and then hand this to the patient and let them read it. And then say something like them about their scores. What do you feel about your scores? If the patient does score in a moderate category, a lot of times they're surprised at that. And if they do score in a moderate category, or there's any substance use at all during pregnancy, proceed to the brief intervention. The brief is a motivational interview style of a conversation. We're going to help you give feedback and then to increase insight and awareness into the risky use of substances. It is not really intended for really high-risk behavior. It's most effective for those in a moderate risk category where people can really cut back or stop substance use on their own. With higher risk behaviors, the brief intervention is used to refer a patient to a more specialized treatment. Part of the brief intervention include the assist feedback report card for patients, and I will go back to this. Excuse me. The report card for patients, which is right here, you wrote their scores on this, is considered part of the feedback. Also, another important piece of information to know about the feedback report card is this is your documentation for billing. This is what will be kept in a paper chart or into an electronic chart to prove that you have done the assist tool. If a brief intervention is completed, the timeout must be written on the assist feedback report card as to the amount of time that the brief intervention took. So let's include that feedback report card. Also, reading through the health risk cards which are associated with the substance the patient tested positive for. In normal settings, there are risks for the baby on these health risk cards as well. The health risk card will look like this. So the patient does screen positive for alcohol. You again hand this health risk card to the patient and read it upside down to them, just as it is on here. Hangovers, aggressive, violent behaviors. When you complete the screening tool and you give them the feedback with the score, you can do something like there are health risks associated with alcohol use. I did some of these to you. You may have heard some of these before, but it might sound a little bit different to you today. Hangovers, aggressive and violent behaviors, accidents and injuries, reduced sexual performance, premature aging, digestive problems, ulcers, inflammation of the pancreas, and high blood pressure. And literally read down this they stop you on one of these and want to talk more about that health risk. As you can see, these are graduated. They get worse as you go down the list. And then once you're done reading these health risks, you can say something like, there's nothing that says any of these things are going to happen to you, but we do know that the only way of cutting back or stopping these risks from happening is by cutting back or stopping your use of this substance. A pregnant woman. On those health risk cards, there is also a maternal use risk. These risks to the fetus or to the baby as the baby is growing, and also health risks that could occur in some of the substances after the baby is born. If mom is pregnant, be sure to read both of these health risk boxes to her. Then with the brief mention is a motivational interview, which helps to increase motivation